Did you know a child's body often whispers before it screams? Spotting subtle signs early can prevent medical emergencies. Today, we'll decode 7 body clues every parent should know. Stay with us and sign number 7 surprises even seasoned caregivers. Persistent high fever. A fever itself is the body's defense, but when a child's temperature stays above 38.5 degrees Celsius or 101.3 degrees Fahrenheit for more than 3 days, or spikes past 40 degrees Celsius 104 degrees Fahrenheit even once, it's a red flag. High, unrelenting fever can indicate pneumonia, urinary infection, or sepsis. Watch for lethargy, rash that won't fade under glass, or breathing trouble. Seek medical care if the fever resists medication, or if the child is under 3 months old with over 38 degrees Celsius. A fever is not the enemy, it's the body's built-in alarm system. When a child's immune system detects a threat, it raises the body temperature to fight off infection. That's normal, and in many cases, helpful, but here's when it becomes dangerous. If your child's temperature stays above 38.5 degrees Celsius or 101.3 degrees Fahrenheit for more than 72 hours, or if it spikes past 40 degrees Celsius 104 degrees Fahrenheit even once, it's a sign you shouldn't ignore. Why? Because persistent or very high fever can be a symptom of something more serious, like pneumonia, urinary tract infections, or in rare but critical cases, sepsis, a life-threatening reaction to infection that spreads rapidly through the body. But fever isn't just about numbers. Pay attention to how your child looks and acts. Are they extremely lethargic, not waking easily, not responding to you? Is there a rash that doesn't fade when you press a glass against it? Are they breathing fast or seem to struggle to catch their breath? These aren't just fever symptoms. They're emergency clues for infants under 3 months old. Any fever above 38 degrees Celsius 100.4 degrees Fahrenheit should be considered urgent. Their immune systems are immature, and what seems like a mild illness can escalate rapidly. Another sign: if your child doesn't respond to fever reducers like acetaminophen or ibuprofen, or if the fever keeps returning for more than a week, it's time for blood work. This may point to autoimmune conditions like juvenile arthritis, or even leukemia in rare cases. So don't just treat the fever. Watch the whole child, how they breathe, move, sleep, and behave. Fever is just the symptom. Your job is to see what it's trying to tell you. If you're unsure, don't wait. Call your pediatrician or head to urgent care. When it comes to persistent fever, it's always better to be safe than sorry. Rapid or labored breathing. Children breathe faster than adults, but more than 50 breaths per minute at rest. Chest indrawing, nasal flaring, or a high-pitched stridor are danger signs. These can mean asthma attack, bronchiolitis, or airway obstruction. Blue lips or nails mean low oxygen. Call emergency services. Keep the child upright and calm until help arrives. Breathing is something we often take for granted until it changes, and in children, breathing patterns can change quickly. But how do you know when it's serious? First, understand this. Children naturally breathe faster than adults, but when that breathing becomes rapid, noisy, or visibly difficult, it's no longer normal. It's a red flag. Here's what to look for: more than 50 breaths per minute in a resting toddler, not just after running or crying. Chest indrawing, when the skin between or below the ribs visibly pulls in with each breath. Nasal flaring, when the nostrils widen on every inhale. Wheezing, a whistling sound when breathing out, or worse. Stridor, a harsh, high-pitched sound when breathing in that usually signals an upper airway obstruction. These signs can point to a number of serious conditions: asthma attack, where the airways tighten and swell; bronchiolitis or pneumonia, common in infants and toddlers, especially during winter; or even a foreign object stuck in the airway. One of the most dangerous signs is cyanosis, when the lips, tongue, or fingernails appear blue or purple, that means oxygen levels are dropping, and it's time to call emergency services immediately until help arrives. Keep the child calm and upright. Loosen tight clothing. Don't force them to lie down. That can make it harder to breathe. And avoid giving them food or drink, especially if you suspect choking or labored swallowing. Parents often wait, hoping symptoms will pass, but with breathing, time matters. The child can compensate for difficulty breathing for a while, but once they begin to tire, things can decline fast. You don't have to know the exact cause, you just have to recognize the danger. If your child is struggling to breathe, don't wait, act quickly, trust your instinct, and get medical help. Unexplained rash or bruising. A rash that doesn't blanch under glass pressure, spreads quickly, or appears with fever can signal meningococcal infection or septicemia. Sudden widespread bruising or tiny purple spots petechia may indicate blood clotting disorders or leukemia. Document the rash. Then seek urgent care. A rash in children is common. Most are harmless, linked to heat, mild viral infections, or allergies, but some rashes are the body's cry for urgent help. The one phrase every parent should remember is this: Does the rash blanch? That means, does it fade when you press a clear glass gently against it? If the rash disappears under pressure, it's likely not dangerous. But if it stays visible, dark red, purple, or blotchy, even under glass, that's a warning sign. This kind of rash could signal meningococcal infection, a fast-moving bacterial infection that can lead to septicemia or blood poisoning. And when we say fast-moving, we mean hours. It can escalate that quickly. Watch for these additional clues. The rash spreads rapidly. The child develops a high fever. They seem confused, drowsy, or hard to wake. Another red flag: unexplained bruising, especially if it's appearing in places where no injury occurred, like the back, stomach, or upper arms. This could indicate a bleeding disorder, such as ITP, immune thrombocytopenia, or even more serious conditions like leukemia. Also, look for petechia, tiny purple or red dots that look like pinpricks. They don't fade with pressure. And they're a key sign of broken capillaries under the skin, often linked to infections or blood disorders. Here's the bottom line: you know your child. If something about the rash or bruising feels wrong, don't brush it off as just a virus or nothing to worry about. Take photos, especially if the rash is changing or spreading quickly. Show those to your doctor or bring them to the ER. In some cases, fast action can prevent life-threatening complications. Remember, not all rashes are dangerous, but the dangerous ones don't wait, and neither should you. Severe abdominal pain or swelling, sharp, localized pain especially in the lower right abdomen may be appendicitis, pain that wakes the child or escalates with movement, plus vomiting and fever. Needs a evaluation. In infants, distended belly with projectile vomiting can mean bowel obstruction. Don't mask pain with analgesics before seeing a doctor. Every child gets a tummy ache once in a while. Most are harmless, related to gas, mild constipation, or even stress, but some abdominal pain is a warning, and knowing the difference can make all the difference. Here's when to pay attention: pain that's sharp, focused, and doesn't go away, especially if it's in the lower right side of the abdomen. That could be appendicitis. Appendicitis pain usually starts near the belly button and moves downward. It can worsen when the child moves, coughs, or presses the area. Big red flag: if the pain wakes your child at night, or comes with vomiting, fever, or a distended belly, don't wait. These are signs of something serious. Another danger: intestinal obstruction, especially in infants and toddlers, or conditions like intussusception, where part of the intestine slides into another section, can cause intermittent, cramping pain where the child screams, then suddenly seems fine. Projectile vomiting, swollen or firm belly, or blood in the stool, which may appear like jelly or mucus. These symptoms can easily be missed in very young children who can't describe what they're feeling. That's why behavioral clues matter too. Is the child curling their legs up to their chest? Is their belly unusually firm or round? Are they refusing to eat or even move? One more thing to remember. Avoid giving painkillers like ibuprofen or acetaminophen before a child with severe abdominal pain is evaluated by a doctor. Painkillers can mask symptoms and make it harder for doctors to pinpoint the issue. Bottom line. If your child's abdominal pain is persistent, localizes to one spot, or is accompanied by vomiting, fever, swelling, or unusual behavior, it's time to act. A child may not be able to say this feels urgent, but their body and their instincts often do. Dehydration from vomiting or diarrhea. Look for dry lips, sunken eyes, absence of tears, and fewer than one wet diaper in 6 hours. Persistent vomiting or watery diarrhea strips fluids fast, risking seizures. Begin oral rehydration immediately. And seek care if fluids won't stay down or lethargy appears. Kids get stomach bugs. It's part of growing up. A bit of vomiting or a few loose stools. Usually nothing to panic over, but when vomiting or diarrhea lasts, escalates, or both, the biggest danger isn't the virus, it's dehydration. Children, especially babies and toddlers, lose fluids much faster than adults, and they can't always tell us when they feel weak, dizzy, or dry inside. So how do you know when dehydration is becoming serious? Watch for these signs: dry lips and mouth, sunken eyes, no tears when crying, cool, mottled skin, or fewer than one wet diaper every 6 hours in infants. That's a major red flag. Older kids might say they're thirsty, but by the time a child is very thirsty, they may already be moderately dehydrated. And if the vomiting is so constant that your child can't keep fluids down for more than 8 hours, or the diarrhea is explosive, watery, and nonstop, it's time to seek medical care. Another clue: lethargy. If your child is unusually quiet, sleepy, or unresponsive, it could be the result of electrolyte loss, not just being tired. So what can you do? Begin oral rehydration at the first signs. Use a pediatric oral rehydration solution ORS, not just water. These replace sodium, potassium, and glucose, critical ingredients the body needs to stay balanced. Avoid sugary drinks like juice or soda. They can make diarrhea worse. Don't force food. Fluids come first. If your child shows vomiting plus lethargy, sunken eyes, or goes hours without peeing, it's not a wait and see moment, it's I go now moment. And remember, dehydration can creep in quietly. By the time you notice the signs, your child may already need help rehydrating with fluids at a clinic or hospital. So stay alert and always prioritize fluids, energy, and your instincts. Excessive thirst and urination, sudden non-stop drinking, nighttime urination, or new bed wetting can indicate onset of type 1 diabetes. Spot fruity breath or rapid breathing. That's possible. Diabetic ketoacidosis. Get to the F4. Insulin and fluids. Children get thirsty, especially after playing or in hot weather. But if your child is suddenly drinking water constantly, asking for more even after big gulps, or waking up multiple times a night just to go to the bathroom, it's time to pause. One of the earliest warning signs of type 1 diabetes in children is something called polyuria and polydipsia, excessive urination and thirst. It happens when the body can't produce insulin, the hormone needed to move sugar from the bloodstream into the cells. Without insulin, glucose builds up in the blood, and the body tries to flush it out through the kidneys. The result: frequent urination and constant thirst. Parents may also notice sudden bed wetting, even if the child had been dry for months or years. Fatigue, despite good sleep. Weight loss, even with normal or increased appetite, or a strange, fruity smell on their breath. If not caught early, this can quickly progress to a dangerous state called diabetic ketoacidosis (DKA), where the blood becomes too acidic. DKA is a medical emergency and can cause rapid breathing, nausea or vomiting, drowsiness or confusion, even unconsciousness. Type 1 diabetes can develop suddenly. It's not caused by diet or lifestyle, and it's no one's fault, but catching it early can save your child's life. So if your child is going to the bathroom far more than usual, waking up drenched in sweat and thirsty, drinking large amounts of water every hour, or suddenly bedwetting again, don't ignore it. Don't wait for other symptoms. Ask your doctor for a simple blood sugar test. It takes minutes, and it can change everything. In the case of type 1 diabetes, early diagnosis and insulin therapy can prevent complications and give your child a healthy, full life. Sudden neurological or behavior change, unusual drowsiness, confusion, irritability, or severe headache may signal meningitis or stroke. Neck stiffness, light sensitivity, or seizures without fever require immediate attention. Trust your instincts. Dramatic behavior change is the brain's way of calling for help. Kids have moods. They cry, they pout, they get tired or cranky. But when your child's behavior suddenly shifts in a way that feels off or alarming, it may not be emotional. It may be neurological. What does that mean? It means the brain might be sending signals that something's wrong, and it's using behavior, speech, or movement to show it. Be alert for changes like a normally active child who becomes extremely drowsy, sudden confusion, disorientation, or unresponsiveness, repeated complaints of a severe headache, trouble with vision, balance, or speech. These symptoms can point to meningitis, an infection of the brain's protective membranes, encephalitis, inflammation of brain tissue, or even a stroke. Yes, strokes can happen in children. 2. Add in neck stiffness, vomiting, or sensitivity to light, and it's time to act fast. These are classic signs of central nervous system infection. Another red flag, seizures, especially if there's no fever and they've never happened before. A seizure might look dramatic, twitching limbs, eyes rolling back, loss of consciousness, or it might be subtle, staring spales, lips smacking, or repetitive movements. Either way, don't wait to see if it happens again. One seizure, even short, needs medical evaluation. You should also take sudden changes in personality or motor control seriously. Slurred speech, drooping on one side of the face, inability to hold a toy or walk straight. These could indicate a neurological emergency, like bleeding in the brain or a tumor. If your gut says, "This isn't my child, something's really wrong," trust it. You don't need a diagnosis, just the awareness to seek help quickly when the brain is involved. Every minute matters, and while many of these symptoms may have benign explanations, it's far better to rule out something serious than to wish you had acted sooner. Children can't always describe what's happening in their bodies, but they show it. And as their caregiver, you are their best chance at being heard in time. Children can't always explain what hurts, but their bodies do. By learning these 7 signs, you can act fast and potentially save a life. If any of these red flags appear, contact a healthcare professional immediately. Subscribe to Your Body's Clues for more parent-friendly, science-based health insights next week. Hidden nutrient deficiencies every caregiver should know.